right, everyone. Welcome to Pathways to Nursing and Health Profession. Again, I'm going to turn off my camera so we can focus on the presentation. So before we get started, I just want to go over some important guidelines and Zoom etiquettes. As a reminder, this presentation is being recorded. Also, make sure your Zoom display name matches your name in SF State records. We will be sending you some of the resources and PDF copy of the presentation after the workshop. Therefore, it is very important for us to identify you and be able to send you the documents. Some of the few Zoom etiquettes, please again mute your audio. There's a display image right here, how to mute your audio. Also, please use the chat box for your any questions that you may have. We have Jess and Amy as our moderator for today's workshop. Thank you, Jess and Amy. They will be able to answer your questions via chat. You can find the chat box on the Zoom toolbar next to the share screen. So before we get started, I would like to introduce myself. My name is June Para. I am the retention specialist for the College of Health and Social Sciences. Also, I am a shared advisor for our college and the UAC, the Undergraduate Advising Center. You can reach me at junepara@sfsu.edu. Again, welcome everyone. So for today's agenda, we have 4 steps that we are going to go over. Step 1, we are going to do an activity which will provide you the opportunity to explore and identify what you love. Step 2, what are your options? We will discuss things like backup majors and career paths and other similar careers to nursing. Step 3, we will discuss how you can get to those other options. And finally, step 4, we'll be talking about the idea of trying different things and going through the exploration process again if you need some readjustment. Step 1, what do I love? In the process of exploring different career pathways, it is very important to identify what you love. Regardless of where you work after graduation, you will be spending a lot of time there. And I think you will be doing something you enjoy, right? So in order for us to get thinking about what you love, we're going to do an individual activity. In this activity, you will write "I love" in the center of the page. Then you will think of aspects of yourself that are important in defining who you are. This doesn't have to just be about academics and your career. Think about the hobbies you love, the kind of environment you really enjoy, and your own core values. Lastly, you will write each aspect in a shape and size of your choosing. Perhaps aspects that are more meaningful to you can be a different shape or size than other aspects. So we usually share our work with each other, but since we are doing this workshop via Zoom, I would like for you to share via chat 1 to 2 aspects that are meaningful to you. Then finish this activity later and send it to me. I will give everyone about 1 to 2 minutes to share their thoughts. Whenever you are ready, please write your responses into the chat box. So I'll set my timer in 2 minutes and then we'll get back to the presentation. So feel free to share your responses in the chat box. All right, so it's about a mid or so. So I'll go ahead and continue the presentation, but feel free to keep sharing your responses, okay? I look forward to reading your responses after this workshop. I appreciate I appreciate you sharing your responses. And here's an example of my poster that shows some of the few things I love. I like to eat healthy and exercise to have a healthier lifestyle. I like fashion and traveling. I'm a huge foodie because I love all food. I love my family and I create my own family. For example, I love my work family and friends that I consider as my family. Lastly, I love counseling. I completed my bachelor's degree in liberal studies concentrated in math because I thought I wanted to be a math teacher. After I graduated and finished I finished my student teaching, I realized that it wasn't for me. Therefore, I further explored in other majors and came across the counseling program. I completed my master's degree in counseling at Fresno State, and now I get to do what I love and fulfill my passion. Journal activity. So you can do this later, but being able to reflect through journaling is a really great way to get to know yourself. As we go through our lives, we sometimes just go, go, go without taking time to ourselves to truly understand who we are, who we want to be, and what we want to bring to the world. Journaling can help you slow down and try to figure all of this out. These are two other resources you can use to learn more about yourself. Has anyone heard of Myers-Briggs? 16 personalities can give you a version of that. You can then look up careers that work well for your personality type. You can also do this at the Career Center too for a more official version. Another tool is the interest profiler. You can take a quiz and explore some career options that might work for you. We encourage you to do a journal activity or complete one of these quizzes to dig deeper into figuring out who you are so that you can identify a path that works for you. Step 2, what are all of my options? Please make sure to make an appointment with an SRC advisor to go over your pre-nursing ed plan. Here's the website to make an appointment. As a reminder, at the end of the presentation, all participants will receive the PDF copy of this presentation. Therefore, all the links that I'll be sharing with you, you will have it at the end of the presentation or the workshop. All right, so other pathways to nursing. The option listed here do not require getting a 4-year degree, aka a bachelor's degree, which is what you are all working toward right now as a student at SFSU. These programs are usually earning a certification or an associate's degree and can range in length. You can get most of these done at a community college. So let's get started. Let's go ahead and go over the ADN pathway, Associate's Degree in Nursing. It is a 2-year degree that allows you to get your RN license. So technically you don't need a 4-year degree in order to be a nurse. You can go to a community college, get your ADN, and get your RN license. This option is quicker, definitely more affordable pathway to becoming a nurse. One caveat is the career choices can be limited than those with a BSN degree. Okay. Another option is the Cna Slash Lpn Pathway, Certified Nurse Assistant. You will need to earn a certification and pass a test. Usually the process is about 4 to 12 weeks. CNA provide entry-level care like taking vitals, cleaning rooms, and helping patients with their daily activities. A licensed practical nurse and licensed vocational nurse, LPNS and LVNS, do more extensive work, and they do pay more than CNA. Neither will allow you to take the RN exam, so keep that in mind. Another option is the EMT route. EMTs are most frequently found in ambulances, and some provide care for patients being transported by air. It's about 1 to 2 years of schooling. Second bachelor's degree in nursing. Let's say you do want a BSN degree, but you don't get in when you apply. You have the option of doing a second bachelor's degree in nursing. What that means is that you graduate from SF State with another major like biology or public health. And after you graduate, you come back to SF State to get a second bachelor's degree. You do need to make sure you complete all the components of the nursing application requirement as you know them now. So let's go ahead and list it. So you will need to complete the 5 prereqs, Math 124, Bio 210 to 11, Chem 101, 102, Bio 212 to 13, which is your physio, and Bio 220, which is your anatomy. Minimum of 3.0 GPA from these courses. Also, you will need to take your TEAS exam. You are allowed to take it 3 times, minimum score of 78. Also, you will need a letter of verification from your work/volunteer health experience. You will graduate with any major, then you will apply to Cal State as a graduate student and turn in the application and documents at the nursing CAS. Please make sure to go to the School of Nursing website for application period. You will graduate in 2 years. You do not need any GE requirements. All you need to complete are your major courses. Another option for you would be the ELM or ELMA. ELM stands for Entry-Level Master's Degree in Nursing. ELMA is the accelerated version of ELM, meaning it's faster. So what's cool about this program is that you spend the first 2 years completing the BSN curriculum, and after 2 years, you are eligible to take the NCLEX exam. The last year is dedicated to the master's level curriculum. Also, have the possibility of becoming an RN while in the program. Here are the requirements. You will need to possess a non-nursing bachelor's degree, California residence, or be eligible for in-state tuition, minimum GPA of 3.0 or above in the last 60 semester units earned, evidence of health-related work/volunteer experience, a personal statement, 3 letters of recommendation, complete all the prerequisite courses, same as the BSN courses. The science prereqs must be taken within the last 7 years. Again, you're gonna apply to Cal State as a graduate student and then turn in the application and the documents needed through nursingcas.org. Once again, please make sure to go to the School of Nursing website for the application period. If you choose to do a second bachelor's degree or the ELM/ELMA pathway, know that these do not require a specific undergraduate major. So what do you major in for your first degree? We advise for you to choose a major that will help you be more well-rounded as a nurse later, and or a major that intrigues you. Here are some of the majors that you might want to consider as a backup plan. So we have ethnic studies majors such as African studies, American Indian studies, Asian American studies, Latino studies. We have nutrition and dietetics if you want to work with food, family and consumer science. We have kinesiology, social work, anthropology, child and adolescent development if you want to work with children, recreation, park, and tourism if you like outdoors, speech, language, and hearing sciences, modern languages as Arabic, Chinese, Japanese, Spanish, and more, sociology, health ed, actually they have a new name, it's called now public health. We have psychology and many more. So I also included the bulletin right here because there are so much more majors you can explore. Also, the ones in white writing are impacted majors, which means you will need to fulfill certain requirements in order to apply to the program. So keep in mind that some majors at SF State are impacted, and some are non-impacted. If they are non-impacted, you can just change it through your student center. All right, so similar classes. Now, what if you're like, well, I already took all these prereqs and I don't want to waste them and take a bunch of new prereqs for a new major? Well, here are some majors that have science prereqs that are similar to the 5 nursing prerequisites. So we have Health Ed, Math 124, Bio 210, and 211. They also require those courses. We have Kinesiology. They require Math 124, Chem 101, 102, Bio 212, 213, and Bio 220. We have Dietetics and Nutrition Science. They require Math 124, Bio 210, 211, Bio 212, 213, and Bio 220. And then we have Food and Community Nutrition. They require Math 124, Chem 101, and 102. Know that these majors, they might require other prereqs in order to get into the major. And of course, know that all of these majors requires different courses for their major program, for their degree requirements, okay? So always consult with your advisor. So other pathways to healthcare professions. So let's go ahead and get started with the clinical laboratory science. So for this profession, you will work in a lab to analyze samples for patients, research, forensics, and more. And there's a website to learn more about this profession. Another option is physician's assistant. This role is similar to that of a nurse practitioner, but less schooling. After you graduate with your first degree, this will be about 2.5 to 3 year program. Or you can pursue a doctorate degree. No specific major needed. You just need to complete the science prereqs. Med school is about 4 years plus 3 to 7 years of residency at a hospital. And there's a website to learn more about it. So med school has a reputation of being very expensive, which can be intimidating for some folks. Programs such as Public Service Loan Forgiveness and Title VII Scholarship for disadvantaged students help ensure medical education is accessible to students from all backgrounds and offer incentives in targeted areas. So if you have a passion to become a doctor, go for it. Next, we have registered dietitian. So for this career, you will need to major in nutrition and dietetics, concentrated in dietetics and nutrition science. This is a non-impacted major. So what that means is that if you want to switch to nutrition and dietetics, you can just switch your major using your student center. So after you graduate, you enroll in a 1-year internship. The link is there for you to read more about the internship. Take the registered dietitian exam and then start your career as a dietitian. Occupational or physical therapy. Kinesiology is an excellent major for both OT and PT, but not a requirement. Kin is an impacted major. So again, impacted means that there's prereqs that you need to complete in order to get into the program. See our handouts for more information. So occupational therapist. So you will focus on helping patients with mastering the activities of daily living. You will need to do a Master's of Occupational Therapy program or an entry-level doctorate of Occupational Therapy program. It's about 2 to 3 years. Physical therapy, you will focus on helping patients recover range of motion and decrease pain after an injury or illness. Complete a Doctor of Physical Therapy program. The SF State and UCSF program is about 3 years. And there's a link here to learn more about it. Speech therapist and audiologist. So speech language pathologist helps kids with language disorders. They also help people regain their speech after a stroke and more. You will need to major in speech language hearing and sciences and also pursue a master's degree in communicative disorder. At SF State, we have a 2-year program. Do a 9-month post-program clinical fellowship and then take the licensing exam. An audiologist, they diagnose, treats, and monitor auditory disorder and balance disorders. You will need to major in speech, language, hearing sciences, do a doctoral degree in audiology, about 4 years, and then you will take the licensing exam. Wellness careers. So here are some few careers that are under the wellness career. So helping people can also look like promoting other people's wellness. So we have recreation therapy. They help individuals with disabilities improve their quality of life through recreation, art, music, and so forth. So you will need to major in recreation, park, and tourism, and then earn a certification. Psychiatry, they will prescribe, administer, or direct psychotherapeutic treatments or medication to treat mental, emotional, or behavioral disorders. You will need to major in psychology and then earn a doctoral degree. And we have social work. They help individuals meet their needs with focus on those who are vulnerable, oppressed, and in poverty. You will need to earn a social work degree plus a 2-year master's program. We also have counseling. So counselor helps individuals identify and pursue their personal, academic, and career goals. You will need to earn a bachelor's degree plus a 2 to 3 years master's program. So for counseling, there's various of counselors that you can pursue. You can pursue a K-12 counseling program. You can do a college counseling, or if you want to do a marriage and family counseling, there's various counseling pathways for you if this is something that might interest you. I myself enjoys helping individuals, and I get to fulfill my passion through my counseling/advising career. Step 3, how do I get there? So explore parallel majors. We encourage you to go to these websites, explore further each of the major from each departments, utilize the bulletin to identify what majors we are offering and what are some of these majors that is congruent with your interests and your strengths. So explore. So also research more. So we have here some few resources that you can utilize to research further with your exploration. So we have mynextmove.org, explorehealthcarecareers.org, rn.california.gov, nursing.org, allnursing.school.com, and then student residence amc.org. So I encourage you to go into these links and identify if these resources can help you towards your healthcare career. I also recommend for you to research one new career or new program each week. Do some pros and cons, have some question about the new career program that will help you identify if this new career program is for you. Also, we have this template here to help you get organized, right? So I believe Jess will be putting the template in the chat box. Please utilize it. And you can also modify it into your liking. At the end here, it says add your own. So add like questions that you may wanna include when you're exploring each school or each programs. So again, please utilize this template as you explore further for other programs or career that you may wanna explore. So how to declare a parallel major? So again, research first, right? So very important to research and identify what are some of the options that you have or majors that you may have that is congruent with your interests and strengths. So we have our website, we have majors website here, we have the bulletin, so go through your options. Once you're done researching, talk to someone, talk to an advisor, major advisor, or a GE advisor, your UAC advisor. We are here for you, right? So we want to guide you and support you throughout this process. And after talking to someone, you can complete the application requirements if needed. As I mentioned already, Some majors are impacted and some are not. If the majors are not impacted, you can just change your major using your student center. And then when you change your major, it depends on the department because it varies of how they admit students. Here are more resources and support that we want to provide for you today. We want you guys to utilize this towards your healthcare career. So some of the resources are the SF State Build, Mentoring in Medicine and Science, EMS Corps, Healthcare Career Connection, Summer Student Research Program with Children's Hospital, Oakland Research Institution. So please utilize, please look over these links and identify if these resources can provide you some support, and you can utilize these resources towards your career path. So I highly recommend for you guys to consider joining our SF State Nursing Student Association. You will be able to network with your fellow nursing colleagues and learn more about opportunities in the nursing community. You can reach them through these links, or you can email them at nsaofficers@gmail.com. So part 4, give it a go and readjust if needed. It's okay to explore, to be unsure. When people ask you about your career or major, you can just say, I want to be in a helping profession and I'm still exploring which will be best for me. Changing your mind is normal. The only way to do great work is to love what you do. If you haven't found it yet, keep looking. Don't settle. As with all matters of the heart, you'll know when you find it, by Steve Jobs. It is more than okay to change your mind about your career path. It will be worth it at the end when you are in a career that you enjoy doing. We're here to chat. So unfortunately, due to COVID, we are not available to meet in person. However, we can meet via Zoom. You can go to our website and schedule an appointment with us. And we hope to see you soon. So my last quote for today is, when you do what you love, it's not work anymore, by J. Baldwin. I truly believe in this saying because what I do now doesn't feel like work. It feels like something that fulfills my professional and personal goals. I don't feel obligated to do well. I want to do well because I love what I do. And this is the end of my presentation. It is time for Q&A. I will try my very best to answer your question. I'm pretty sure Amy and Jess were fantastic answering your question, but let me put my camera back on. All right, everyone. I hope that was very informative for you guys, but maybe you can raise your hand and then I can answer your question if you have any. Do we have any questions? You can put in a chat box.
Hi, June. Jean asked, what does parallel majors mean?
So parallel majors is similar to the nursing. So any health care majors like public health or kinesiology, RPT, it depends on your perspective, right? Like some people say like, you know, kinesiology is not really health, but there's a lot of people who will argue that kinesiology is still in health field. So I hope that answered your question. Thank you, Gina, for that question. Any other questions?
So someone asked if pre-nursing students can join the nursing association or only current nursing students. I believe that only nursing students, like declared nursing students, can join, but they do host events once in a while, and we will post those on our website once we hear about them.
Yeah, absolutely. And I myself, I'm the type of person like, okay, like it says here, but I want to talk to someone that is actually in charge in the program, because you never know, every policy changes every day. So it doesn't hurt if you just email them, say, I'm really interested in being involved in the nursing community. So who knows? I would just say email them. You never know. Maybe they'll make an exception or something. And we just had a nursing panel, which we had a guest from the individuals that is part of the nursing association, and they were wonderful. And the experience that they provided for our student was very rich, and it was very valuable and important for other pre-nursing students to grasp on, so that they can really identify if nursing pathway is for them. So again, I see a lot of benefit being in the program. So definitely contact them and ask them if you can be involved. Thank you. I appreciate that. Any question? Students, other advisors, my supervisor.
Going through the chat right now, Benjamin asks, how will the nursing application work with everything being online? For example, will lab courses still be valid despite being online?
Yeah, absolutely. As long as you pass the course, and as long as you're fulfilling all the requirements, it doesn't matter if it's in person or online. Also, the TEAS exam before COVID, usually students take those in person, but they are now allowing students to take it online as an option. So. Thank you for that answer or question. Any other questions?
Yeah, so there's a few coming in the chat. I'll just read them off to you as they come.
All right.
Will a BS in biology be helpful to me as a nurse?
Can you repeat that again?
Will a BS in biology be helpful to me as a nurse?
I mean, it's science, right? It's a science major. So definitely that's like, I consider that as one of the parallel major to nursing, because you will have a lot of science courses and materials that you will learn from that major. And like I said, if you're pursuing a second bachelor's degree in nursing or a master's degree in nursing, it doesn't really matter what bachelor's degree you will earn, because as long as you earn a bachelor's degree and complete all the requirements, you are eligible to apply to the program. But definitely, a bachelor's degree in biology will definitely help you.
Thank you. And Serena asked, do you know how to get volunteer opportunities in spite of COVID?
Yeah, so the Nursing Association students actually sent us, or I think they will be sending us a list of organizations that students can volunteer or possibly even work for. So as soon as I have that list, I'll contact Amy after this workshop. We'll send it to you guys.
Thank you. And Caitlin asked, is there a required I'm not sure what you mean by your question, Caitlin. If you could reword it in the chat, I'll go ahead and ask June. In the meantime, Annette asked, why is PA a shorter route than NP? And do you have any advice on a pathway to becoming an NP? Can you clarify what NP, or I'm not sure what NP is, so.
Me too.
Maybe nurse practitioner?
Yeah.
So why being a nurse practitioner is,
so
can you repeat the question?
Why is a PA a shorter route than a nurse practitioner? And do you have any advice on pathways to becoming a nurse practitioner?
To be honest, I only know the basic information. So I would suggest, because I like giving my students the accurate information, we do have the links on the slides. And please, Amy or Jess, if you have more information than I do about those programs, please chime in. But I don't really know why there's the difference about the links, and I would advise you to go to the links and further research about the programs. Sorry, I know that I didn't really have a clear answer for that. But you know what? I'll research further and put in the chat your name, and I'll get back to you.
Thank you, June. June also asks, where do you take the TEAS? And for anyone with TEAS questions, I just posted the link to the website, and that has all their testing sites if they're still doing in-person sites, and then the dates of their testing dates.
And then also on the website, there's practice resources and other resources that can help you prepare for your TEAS exam. Also, I know that the majority of the question in the TEAS exam are from your physio and your anatomy. So keep that in mind.
Thanks, June. And then Thomas asked, how many applications are submitted each year and how many applications are approved?
I mean, everyone can apply, approve. So for the BSN program, so we have about 20 to 40 admissions that we admit students in the program. For the second bachelor's degree and master's program, I don't have the exact number, but I know that they have higher admissions, like higher number of admission compared to the BSN program.
Thank you. And Teresa just asked about the requirements for the application. I'm going to go ahead and post the link to the nursing website, and it gives in depth all the requirements and supplemental criteria that they look at.
Thank you, Jess.
And then are there any other questions?
All right, so it is 2:09, but if you have any further questions, you have my email address, junepara@sfsu.edu, or make an appointment with us. We would love to meet with you guys and provide support throughout this process. But I'm gonna go ahead and end the presentation. Once again, thank you guys so much for coming. I hope this workshop helps you understand other pathways to nursing and other healthcare career. Well, have a great day and see you guys later. Bye.
Thank you.
Thank you guys.